Childbirth is an amazing journey, but the recovery can be challenging. If you've had an episiotomy, proper care for those stitches is crucial. In this video, we'll cover everything you need to know to heal quickly and comfortably. Hey there, and welcome to Women's Wellness Guide. Today, I will be sharing some important tips on how to care for your episiotomy stitches after giving birth. First, let's talk about what an episiotomy is. It's a small surgical incision made in the perineum, the area between the vagina and the anus, to help facilitate delivery. After your baby is born, the incision is then stitched up with dissolvable sutures to promote healing. These stitches will gradually dissolve and disappear over the course of several weeks as the area heals. Proper care and attention to these episiotomy stitches are absolutely crucial during the postpartum. Neglecting the stitches or allowing the area to become infected can lead to a variety of complications, including increased pain and discomfort, delayed healing, infection, and perineal wound breakdown. Here are some key things you should do to make your stitches heal properly. Number 1. Keeping the area clean. The most important aspect of caring for your episiotomy stitches is keeping the area clean. Here are some tips to help you do that. Wash your hands thoroughly with soap and water, or use an antibacterial hand sanitizer before touching the perineal area. This helps prevent the introduction of any harmful bacteria that could lead to infection. Use a peri bottle filled with warm water to gently cleanse the area every time you use the bathroom. Avoid using toilet paper, as the friction can irritate the stitches. Instead, pat the area dry with a clean, soft cloth or paper towel. Consider investing in a small, shallow tub called a sitz bath that fits over your toilet seat. Sitting in a sitz bath filled with warm water for 10 to 15 minutes a few times a day can provide soothing relief and help keep the area clean. Change your sanitary pad every 2 to 4 hours to keep the area dry and prevent the buildup of moisture, which can promote bacterial growth. Opt for unscented, hypoallergenic feminine hygiene products to avoid further irritation. Number 2. Managing pain and discomfort. It's completely normal to experience some pain and discomfort in the perineal area after an episiotomy. Here are some tips to help you manage pain during this period. Take over-the-counter pain relievers like ibuprofen or acetaminophen as needed to alleviate discomfort. Use a numbing spray or lidocaine gel specifically formulated for perineal use. These can provide targeted relief to the stitched area. Apply a cold compress or ice pack to the perineum for the first day or 2 after delivery. This can help reduce swelling and numb the pain. Some women find relief by making padsicles, known as sanitary pads soaked in witch hazel and then frozen. The cooling sensation can soothe the area. Avoid any strenuous activity or exercise that could put stress on the stitches and prolong the healing process. Number 3. Monitor for complications. While the vast majority of episiotomy stitches heal without issue, it's important to be vigilant for any signs of complications. Keep an eye out for the following: increased redness, swelling, or warmth in the perineal area, foul-smelling discharge, fever or chills, severe or worsening pain, difficulty urinating, or having bowel movements. If you experience any of these symptoms, it's important that you contact your healthcare provider right away. Prompt treatment can help prevent more serious complications from developing. Number 4 is postpartum follow-up care. As part of your postpartum recovery, you'll typically have a follow-up appointment with your healthcare provider around 6 weeks after giving birth. At this visit, they will examine the perineal area and assess the healing progress of your episiotomy stitches. During this appointment, your provider can offer guidance on when it's safe to resume sexual activity, pelvic floor exercises like Kegels to help restore muscle tone, addressing any ongoing issues like incontinence or persistent pain. They can also answer any other questions you may have about your postpartum recovery and the healing process. It's important to be patient and give your body the time it needs to fully heal. Remember, the stitches will gradually dissolve on their own over the course of several weeks. Rushing back into strenuous activities or sexual intercourse before the area has had a chance to heal can potentially disrupt the stitches and lead to complications. Caring for your episiotomy stitches is a crucial part of your postpartum recovery. By keeping the area clean, managing pain and discomfort, and monitoring for any signs of complications, you can help ensure that your stitches heal properly and minimize your risk of encountering issues down the line. Remember, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider or ask in the comment section. They are there to support you every step of the way during this transformative time. Thank you for watching today's video. Be sure to like, comment, and subscribe for more helpful content on navigating all aspects of women's health and wellness. Take care, and wishing you a smooth and uneventful postpartum recovery. See you in my next video.